The debate over the healthcare overhaul in full swing in D.C., and my next guest feels that while healthcare costs need to be addressed, he hopes that things do not get picked up a la carte in this redo. Joining me now is Executive Director of the Partnership to Fight Chronic Disease and former Assistant Secretary for Health Policy in the U.S. Department of Health and Human Services, Ken Thorpe. Ken, good to see you. When you say a la carte, what do you mean? What is your fear?
Well, my fear is that a lot of the aspects that would control the growth in healthcare spending, for example, to coordinate care in the Medicare program, really need to work together to make sure that patients stay out of the hospital in the first place, aren't readmitted to the hospital once they're admitted. And as the bill is developing right now, these provisions are kind of scattered throughout the legislation. So, you know, we don't spend much time talking about these aspects of delivery system reform and preventing disease in the first place. They're critical if we're going to do healthcare reform right.
But you say that certain types of preventive care programs could save money in just 2 to 3 years. How is that if you are talking about truly reworking a medical system and the way people receive health care?
Well, if you look at these two statistics, a third of the growth in healthcare spending is due to the doubling of obesity since 1990, and 3/4 of what we spend in healthcare is linked to chronically ill patients. So those are our targets. There are proven programs in the schools, communities, and workplace. Employers have done a very effective job of really mitigating disease, and as a result, saving money and increasing productivity. And on the delivery system side, we need to do a better job of working with patients to manage those conditions so they don't get acute flare-ups, get sick, and go to the hospital. Those are things that are really clinical common sense things to do, and they're really bipartisan approaches to doing healthcare reform.
We talk so much, though, Ken, on this program about things that private businesses doing, but we still have 2/3 of Americans who are either overweight and obese. An obese person costs 42% more to treat in terms of medical costs than someone who is not overweight. I don't understand, if we talk about it and all these things that are getting done, why the problem doesn't get worse. Ultimately, don't we need sticks rather than carrots to solve the problem?
Well, we need a combination of two things. We certainly need incentives to get to people to change, but we need to identify programs that work. I think part of the problem is that we've put into place some programs that haven't been very effective. We do have a growing body of evidence that shows that we can put into place in communities, YMCAs run these programs now, employer-based programs that really do work to reduce weight, reduce smoking rates, and with it, reduce the burden of chronic illness.
Ken, but in terms of the obesity problem in this country and curbing healthcare costs in general, aren't we all ultimately, the individual in this nation is going to need to pay more? So each person who has insurance feels the pain and knows what they're spending. Is that really the only way we can do it? And that is the one thing, Congress keeps dancing around this because they don't want anybody to actually have to pay for anything.
Well, I think if you look at the programs, you're right, that are effective out there in the workplace, there are financial incentives to get people to engage in some of these interventions and programs to change their behavior, whether paying more in premiums, or whether they pay less if they're getting along in their care plan, less in out-of-pocket spending. So we know the financial incentives appropriately designed work. You have to have the right programs in place, though, at the same time. So the programs are important to make sure that they're effective, and we got to get people engaged and to participate.
In terms of cutting costs, though, just in the most recent week, Congress voted against raising premiums on some Medicare recipients. There's no sign. Do you see any sign that people in Washington truly want to cut the cost out of our health care system?
You know, I think that's one of the areas that they're really struggling with because, you know, to me, if we're going to get at the bottom of this, we need to do three things. We need to change how we pay, and we need to get the incentives right so that there's not a lot of excess utilization. We need to target the cost drivers, which is this explosion of obesity and management of chronic disease, and we need to streamline the system. It is administratively way too complicated, and even the health insurance industry has pointed out that some very simple fixes here would save over $330 billion over the next 10 years. Let's focus on those three areas as we continue to engage in this debate.
Ken, it was good to see you. Please come back.